No. The member for Mildura.
Thank you, Acting Speaker. In fact, I never get over that side of the stage, or at least not very often. But I do seize every opportunity I get in this place to speak on behalf of my community about rural and regional healthcare. And I think it's important. I hear everyone in this place talk about how every Victorian should be able to access healthcare. And while the Nationals don't oppose the intent of this bill to improve safety and better health outcomes, of course, we'd be in support of that. There are concerns, particularly around workforce retention in regional areas, and the ability for our health services to actually meet the requirements of these new ratios, particularly given the challenges that we already have in our healthcare workforce at the moment. Before I start, though, Acting Speaker, I must recognise the midwife that I had in Mildura, and Sally Barker is her name. I'm sure she won't mind me recognising her. She's still working. She still comments on my socials every time the kids have a birthday. She was brilliant with the prenatal care, the post, and Vicky Broad as well, who is the midwife, and in fact has been named Midwife of the Year from Robin Vale District Health Services, which is the multi-purpose service that I will protect until my dying day to make sure that remains an independent multi-purpose service, because the service that midwives like Vicky and Sally provide for the people of that community is exceptional, and to win Midwife of the Year a couple of years ago is an exceptional achievement. I have several hospitals and several healthcare services throughout my electorate, and I just want to illustrate where the challenges come from to retain workforce, to attract workforce, to support not only the nurses and midwives in isolated areas, but also the people that they care for. Geographical isolation is a real issue, and the prospects of professional development in Mildura. We're very, very fortunate to have La Trobe University and their nursing program. The Dr. Deb Neal wing opened late last year, which is a state-of-the-art wing to train more nurses, which is absolutely phenomenal. Trouble is, we have a housing crisis and accommodation issues to attract people there to take up a course so they can train on the ground. What we actually really need, and what would be a solution to this that we've been working on for a little while, is end-to-end training for GPs, nurses, using Monash School of Rural Health as well. Very fortunate to have them based in Mildura. They also do an exceptional job. However, that's Mildura, which is the very top of my electorate. My electorate spans over 37,500 square kilometres, which is about 16% of the state. And in that, I have 5 different healthcare services with 9 different campuses around there. The most remote is Murrayville. Now, if you can imagine, Mildura's up right on the New South Wales, South Australian border. Murrayville is not a direct line either. You have to go out and around because there are national parks to get around. It is 2 hours south of Mildura and 2 hours from the Murray River, so it is remote. It's the most remote town in Victoria. The closest town is actually Pinnaroo in South Australia. They have a bush nursing hospital. Now, this bush nursing hospital it provides things utilising Mallee Track Health and Community Services. They are able to provide a really comprehensive range of essential medical and allied healthcare services. They do acute, they do urgent care, they do community and district nursing, they do residential aged care, allied health. They will have visiting midwives. They do an incredible amount at this bush nursing hospital in Murrayville that was established by volunteers, a volunteer panel in the 1980s. It hasn't had an upgrade since. They are in desperate need now of a new roof. When you have a facility that is literally falling down and, leaky, that is really hard to attract healthcare professionals to, much less retain them. It's only $200,000 to replace that roof. $200,000. We're not talking millions, billions. We're talking about $200,000 to fix the roof of the only healthcare facility in the most remote part of this state. Because you know what? They're Victorians too. And don't they also deserve the very best of healthcare? I think they do. The community there certainly thinks they do. This is a farming community who, as all Mallee families know, that you learn to do things for yourself, otherwise you don't get anything done. They need some help now. They only need $200,000 to fix a roof. It's a pittance, really, when we're talking about budget blowouts. And this infuriates me. We hear about budget blowouts on major projects, and we've got a bush nursing hospital providing healthcare for communities growing food for the rest of the world. $200,000, and they can't get that. And then maybe upgrading that facility would be able to attract more nurses, more midwives, more allied health staff that service this community in the most remote part of this state, because they are Victorians too, and they matter just as much as someone that's 100 metres from the Epworth Hospital in Richmond, don't they? So we have quite a few issues, and it's a complicated beast. When you have such a vast expanse of the state where people live right throughout, and you don't have all of the required health services, travel is also an issue. We don't have a train, we have a plane, but flights are expensive and you've still got to get to Mildura to get there. A lot of people may travel to Adelaide, but of course the public transport now to get to Adelaide is very, very difficult. Getting to Melbourne is difficult and it's expensive. And in a cost of living crisis, Acting Speaker, more and more people are using the Victorian Patient Transport Assistance Scheme. Trouble is, the reimbursements from that scheme, or VIPTAS, are now taking up to 7 months to come through, leaving individuals and organisations that utilise that service, like SIRS and Sunraysia Cancer Resources. SIRS, I got a letter from them last week saying that they are now owed over $218,000 still from claims that have been put in from October last year. That is insane. So if they are referred another patient, a Category 1 patient, for example, that needs urgent care in Melbourne, with no operating capital in the bank, how do they buy flights and get that person, that patient, the care that they need? Because they can't get it locally. They can't. It is putting lives at risk. As the member for Euroa said earlier today, it is now a life and death situation in regional, rural and remote Victoria. And it is costing lives. Here's another example. Darren, he's 59. He did the at-home bowel scan in September last year, which we're all encouraged to do. Be aware of your conditions. Do the bowel scans. It's treatable if it's got early. He returned a positive test in October. He was told it'd be 3 months for an appointment. He is still waiting in February, not for a colonoscopy, just for a consult because of the public surgery wait lists. He's a Category 1 patient with a positive result. I wouldn't be able to sleep at night if that was me, not knowing if I had bowel cancer or not. So I am just befuddled when I hear members opposite say that every Victorian has access to equal health care regardless of where you live. That is absolute rot. Absolute rot. There are people out in regional, rural and remote Victoria that cannot get an appointment, cannot get a bed, cannot get treated, but we thank our nurses, our doctors, our allied health staff who are working but are so frustrated within the system that it is so hard to retain them in regional Victoria. So we don't oppose this bill, but we do oppose being neglected by this government and the health system in this state.